All right, let's jump right in. As clinicians, you and I both know the postpartum period is this time of just massive upheaval. And for a lot of new parents, that change can open the door to some pretty serious mental health challenges. So today, we're going to create a really clear guide to tell the difference between the baby blues, adjustment disorder, postnatal depression, and postpartum psychosis. Because knowing which is which, well, that's absolutely crucial for keeping our patients safe and getting them the right care.
This is the question, isn't it? It's the one that walks into our clinics every single day. You have a new parent in front of you, they're tearful, they're completely overwhelmed, they are bone tired. So, what are we looking at? Is this just that normal passing phase we expect, or is this the very beginning of a serious clinical illness? Getting this diagnosis right and getting it right early literally sets the entire course for that family's recovery. So, let's break down exactly how to tell the difference.
So here's our game plan. We're going to walk through this whole spectrum, starting with what you'll see most often and building our way up to the most severe. We'll start by setting a baseline with the baby blues. Then we'll layer on adjustment disorder, get a solid handle on postnatal depression, and cover the psychiatric emergency that is postpartum psychosis. Then we'll wrap it all up with a clear, practical toolkit you can use. Okay, first up, the one we're all pretty familiar with. Let's talk about the baby blues. Understanding this inside and out is so important because really it's the yardstick. It's the baseline we measure everything else against. So what are we actually talking about? Well, the baby blues are really defined by these quick mood swings, a lot of tearfulness right after the baby is born. Clinically, we might call it mood lability or anxiety, but for the patient, it just feels like being totally overwhelmed. And for the most part, you can think of this as a physical response to that massive hormonal roller coaster that happens right after delivery. Now, check out this number. 4 out of 5, that's 80% of new mothers. That statistic is just staggering, but it's also an incredibly powerful tool for us in the clinic. It lets us look a patient in the eye and say, what you're feeling is real, and it is so normal. You are not alone in this. That reassurance is huge.
And here it is. This might be the single most important diagnostic clue for the baby blues, the timeline. It's all about the clock. Symptoms usually fire up around day 3 to 5, and, this is the crucial part, they go away by themselves within about 2 weeks. That 14-day mark is our big signpost. If symptoms are sticking around longer than that, our alarm bells should be going off, and we need to start thinking about what else might be going on. So what happens when it's clearly more intense than the baby blues, but it doesn't quite fit the full picture of major depression? You know, when the stress of this huge life event just becomes too much to handle. Well, that's where we find adjustment disorder.
The key phrase to lock onto here is excessive reaction. Look, having a baby is a major league stressor, no question. But with an adjustment disorder, the parent's emotional or behavioral response is just out of proportion. It's more than you'd expect. They feel like they're drowning, like they can't cope, and it's causing real problems in their day-to-day life.
And again, the timeline is our best friend for diagnosis. For it to be an adjustment disorder, the symptoms have to kick in within 3 months of the birth. And they shouldn't hang around for more than 6 months after that stressor. This really specific time window helps us separate it from the short-lived baby blues on one side and more long-term conditions on the other. Okay, we're shifting gears now. We're moving from a condition that's a reaction to stress to a distinct, pervasive clinical illness. Postnatal depression, or PND, is a whole different animal. This isn't just about feeling sad. This is a debilitating condition that needs real, active treatment. So let's put these two side by side, because this is where things can get confusing. First, look at the clock. PND lasts longer than 2 weeks. That's your first big red flag. Second, the severity. We're not talking about mild mood swings anymore. We're talking about a deep, persistent low mood or even feeling completely numb and hopeless. But honestly, the real clinical game changer is the impact. PND gets in the way. It seriously interferes with a parent's ability to function, to care for themselves, and to care for their new baby.
And here is something we have got to hammer home in our practices. This is not just a mom problem, not by a long shot. PND affects about 1 in 7 new mothers? Sure, but look at this. It also hits up to 1 in 10 new fathers. That's a huge number. Our screening, our awareness, our conversations, they have to include all new parents.
So when you're screening, what are you looking for? It's more than just a sad mood. We're looking for anhedonia. That's where nothing feels good anymore, not even the things they used to love. We're looking for changes to sleep and appetite that go way beyond what you'd expect with a newborn. And this is non-negotiable. We are always screening for feelings of worthlessness and, crucially, any thoughts of hurting themselves or the baby. We have to ask the question.
We now have to talk about the most severe, and thankfully the rarest condition on this spectrum. And let me just say, the tone has to shift here. When we talk about postpartum psychosis, the urgency is everything. This is not a let's watch and wait scenario. This is an all-hands-on-deck situation. Let's be 100% clear. Postpartum psychosis is a psychiatric emergency. Full stop. It demands immediate medical intervention and, in almost every case, hospitalization. The safety of both the parent and the infant is at stake. Any suspicion of this has to be treated as an emergency.
The two things that define postpartum psychosis are how incredibly fast it comes on, we're talking hours to days after delivery, and the fact that it's a complete break with reality. This isn't a mood disorder at its core. It's a psychotic episode. And we know it has a very strong link to bipolar disorder. For some patients, this might be the first time that illness ever shows itself.
These right here are your drop everything and act red flags. The patient might be totally confused, not knowing what day it is or who people are. They might have strange, paranoid beliefs or be seeing or hearing things that aren't there. You might also see someone who is incredibly agitated, buzzing with energy, who hasn't slept for days. If you see these symptoms, you escalate care immediately.
Okay, we've covered a lot of ground here, I know. We've gone through all 4 conditions. So now let's pull all of this information together into a simple, practical toolkit. Think of it as a cheat sheet you can use every day in your practice.
This table is basically our roadmap. Let's walk through it. A patient presents at 5 days postpartum, tearful, overwhelmed. You look at the chart. Onset, 3 to 5 days. Symptoms, mood swings. Clinical action, reassurance and support. That's baby blues. Now, a different patient. It's been a month. They can't function, feel hopeless. You scan over to the P&D column. Onset fits, symptoms fit, the action is therapy and maybe meds. And then there's psychosis. Look at that onset, hours to days. The speed of it, plus delusions or hallucinations, is the ultimate red flag that points to one action: immediate hospitalization. It really comes down to using 2 key things: the timeline and the core symptoms.
So I just want to leave you with this question to carry with you. Because making the right call between these conditions, it's not just some academic exercise. It is the intervention. It's what prevents a crisis. It's what helps a parent and child bond. It is what puts a whole family on the path to getting better. Your skill in telling these apart is truly one of the most powerful and impactful things you can do to support a new family.